Warm greetings to one and all. I'm Dr. Roopa Hariprasad, one of the fellows of 2023 India Leadership Journey. I'll be presenting my project Taking Cervical Cancer Screening to Doorsteps of Women, Evidence to Policy. Cervical cancer ranks as the second most prevalent cancer, constituting about one-fifth of all the cancers in women in India. Notably, cervical cancer stands as a unique type of cancer that holds the potential for elimination through vaccination against HPV and screening with a extensive coverage. The current screening test adopted in our national program, which is visual inspection using acetic acid, has many challenges in terms of acceptability by beneficiaries as well as challenges in capacity building of the healthcare providers. WHO's 90-70-90 target, which has to be achieved by 2030, requires high performance test, which is HPV test, preferably through self-sampling by women. That is recommended by WHO. While high-income countries have progressed towards the elimination targets by adopting HPV testing as a primary screening tool for cervical cancer, LMICs like India have a lot of challenges in implementing this recommendation. One of our implementation research studies that completed just before my WomenLift health journey started was in collaboration with state government of Sikkim, focusing on feasibility of introducing primary HPV DNA testing on self-collected samples in one of the district of Sikkim, that is East District. HPV sampling kits were delivered to women's doorsteps through ASHAs. Women performed the test in the convenience of their own homes. The initial tests are very promising, demonstrating the high acceptance of this test by women, increasing the overall screening coverage. With this strong research evidence, I planned my WomenLift Health Leadership Project, aimed to devise a mechanism to get the policymakers on board and sensitize them to scale it up to the rest of the state. This would serve as a model that can be replicated by other states in the country. For this project, I collaborated with Sikkim State's non-communicable division and my colleagues at ICMR. The key stakeholders that were identified included policymakers, state government officials, non-government officials, non-government organizations, community leaders, and medical professionals who were the primary implementers of the program. As a first step to this process, we developed evidence-based advocacy materials and policy proposal for policymakers to support the inclusion of the HPV self-sampling in the program. This compiled document was shared with all the stakeholders. In addition, a meeting was organized for state health officials along with the policymakers of the state, in which the results of this pilot study were elucidated along with the importance of scaling up of potential benefits of the screening method and to elucidate the positive effect on women's health. We also conducted stakeholder interviews to understand perspectives and concerns related to HPV self-sampling from various stakeholders and obtain their insights to shape the advocacy strategy and address stakeholders' interest effectively. Women who are the primary beneficiaries of the cervical cancer screening program highlighted the convenience of self-sampling compared to the traditional screening methods. They emphasized on how self-sampling puts individuals in control of their own healthcare decisions, allowing them to take proactive steps in monitoring their health without relying solely on the traditional healthcare delivery system. In the interview with healthcare providers, that is community health officers and the medical officers of PHC, they expressed how HPV self-sampling helps streamline the screening process and reduces the burden of healthcare facilities and to optimize the resources. State health officials and policymakers hold a crucial role in shaping the healthcare policies and regulations. So they express their concerns regarding the limited financial resources. That was the main challenge what they expressed, and also the budgetary constraints impacting the feasibility and sustainability of this new program. They also were apprehensive regarding the additional infrastructure that is required for setting up this HPV self-sampling services. So this phase of the project is still ongoing with interviews of policymakers and other higher officials pending. Additionally, the next step involves discussing how to present this evidence to decision makers at the policy level. And these discussions are scheduled for the upcoming months. So this project aligns with several themes and learnings from the learning touchpoints and the journeys for leadership styles. By leveraging these connections and by embracing authentic, inclusive, strategic, and impactful leadership, has helped me in empowering my team, stakeholders, and women beneficiaries to actively contribute to the project's success. Regularly reflecting on the learning touchpoints and the journey's leadership styles has helped me immensely to make informed decisions and enhance project efficacy. Thank you, WomenLift Health team, for this wonderful opportunity. I thoroughly enjoyed this journey.